Hi everybody, I'm Christine Sutherland and welcome to Maternity Mondays. I am delighted to have Andy, and he is the proud father, and Katie's on the table, and then we have their wonderful niece, Bianca. Thank you for coming. This is a treat. So what we're going to do is we're going to show you how Andy and I do a sideline position for the back massage. How pregnant are you, Katie? And you can come around this way too, Bruce. And
32 weeks.
32 weeks. So did you see that nod? Yep, 32 weeks. And the other way around. How many weeks to go?
8.
8. Yes, that's what we're most inventing. Okay, so I'm going to get some of the coconut oil, and I'll get rid of you in a minute. And I probably have enough for everybody, so take a little bit. Okay, there we go. I think I got enough coconut oil for the entire town of Fort St. John. Okay, and then you can just come and shoot down to Bruce. We're gonna start here and come to my shoulder here, Bianca. Put your hands on mine. I'm gonna take you for a ride. So we're gonna go down, yep. And I would get the camera higher so you can see what we're doing at the very bottom here. So you can see how we're leaning, our arms are outstretched. Then we split and we're coming back up the sides. And then Bruce, as she's doing that again on her own, if you want to come around here and shoot from this angle, that's great. Yep, that's good. How does the pressure compare?
Actually going down pretty good.
Okay, and let's move her so you don't have to jump. So we're going to get you to wiggle back this way with your shoulder. Thank you very much. Great. And then you can get more so that you're pushing here and then down like that, and you really have to keep the pressure onto the lower back. Yep, nice and slow. Perfect. Yep, and out to the side. Stay on her. Yep, and loop right around her shoulders. Great. And then we'll get you out of that on, and we'll put Andy on next. And you can get rid of the watch because we're going to go into ringing and ring it right onto her. Andy, I know this is going to be like review, but yeah. And you want to make sure you're always flat on the hand, so use the whole palmar aspect of it. Yeah, good, good, good. Out and around you go. Yeah, we've got the tattoo showing up nicely. That's very good. Tattoo, what does it say? It's something of dew.
Yeah, remnants.
Remnants of dew.
It's a memorial tattoo.
Oh, it's good. Nice work. Isn't your uncle a whiz? It's amazing. Okay, so you can ring the upper, I'll ring the lower, and come your hands on mine again. And you might want to get in between us, Bruce. Okay, so here we go. We're going to ring like this. And we're going to do it both sides, like we're going way down there to the table. So come on down, Bruce. Go. Yeah, Andy, if you can get right down there. Yeah, and really put your heels on mine, Bianca. The heel of your hand, that is. Yep. Just put the heels of your feet on. That was good. Okay, and I'm going to let you go again on your own. Okay, so you push and pull. How are they doing? This looks great.
Yep.
I've never had an uncle and niece technique. This is nice. And one foot in front of the other gives you that stride position like Andy's doing. And then you can really push and pull. And especially lower back, lower back. Yep, you got it. Okay, now we're going to switch and get those hard-working shoulders. So I'll show you how that goes. Let me butt in, you guys. So we're going like this. Okay, so one of you can take lower and fit right in there. So Bianca, why don't you do the lower? Ring there. Andy, come around and replace me. I'll get you me there, Bruce. And we're going to do upper. Yeah, so you might want to get, this angle looks really good. And you really want to wrap right to the front. Yeah, so you can be more shoulder to shoulder. It's more like hip to hip with your ankle. And have that stride position again. How are they doing? This looks amazing.
Yeah, they're pretty much
and
the same
got
pressure.
Pictures to prove it.
Yeah.
Nice work. Did you hear that? Similar pressure, Bianca. Yay. Okay, here comes the complicated stuff. So this is where, come around again and put your thumbs on mine, because Andy already knows this one. 1, 2, 1, 2. And you can see, folks, we're doing the domestic technique of bandages on the thumb, which is very good. You could never get away with that professionally, but because this is the family rub, your bandage is perfect. There we go. Can you press on my thumb? Yeah. Let me take you for a ride. Okay, now you're really good at this. You're ambidextrous because you're the one taking me for the ride. How did you get to be good at using both thumbs? Go for it. Do you play the piano or something like that?
I play the flute.
Mm-hmm. You play it well. Look at this. This is very balanced. Okay, if you want to take lower back, Andy, and Bianca, you can keep up in the upper back. Nice work. And that's, I find, a really nice fit. If you come even more where I am, you can fit like this hand right in the front, and this shoulder right here is where it gets really tight, right at the top. Yep. Is that hurting your thumb?
No.
Okay, you can go for the bandage technique then. Yeah, up and out, up and out, up and out. Nice work. And you can see what Andy's doing there. He's going along the top of her pelvis. So folks, there's a big muscle, the latissimus dorsi, that hooks into that iliac crest there. And isn't that relieving? It's one of the ones that Katie really appreciates, all this lower back stuff. And if you drape to the waist, you're just not going to get what you need to get there. So you want to get down on that sacrum again. And you can see how he backs up. Can you look at that posture, Bruce? So that you've got the stride of his feet and how that back leg kicks back. And that way you can't ruin your back. And you can wiggle your pregnant wife or partner to the edge of the bed. All beds are high these days, like they're way up there. But you can also adapt this to the picnic table outside.
We maybe won't do that.
Well, we could put you in a bikini though, and then we could take you anywhere. Okay, so let's go back to a long effleurage. And this time, Andy's gonna come up and you're gonna come down. Let me show you how this works. Okay, you come up there, and then as he goes out the side, and you might wanna come around here, Bruce. Watch this, I'll go down the center. Okay, did we try this before?
I think so.
I think so, it feels like it. Okay, then he's coming up. I'm coming backwards. Okay, dip right in there. So you'd be coming down. Yeah, you got it. Oh, doesn't that look great? Yep, and out. Nice work, team. Yay. Okay, and then we're gonna finish with light reflex stroking. We got that effleurage stroke down. So what they just did, folks, it's called effleurage. Light stroking like a pussycat. You take that side, I'll take this side, and you can go towards you. Okay, so like this, it's kind of like one, like a conveyor belt, yeah. And light, light, light. This is often good when you've been doing the compressions, you know, with labor and delivery. Remember we were practicing those? And then you do this light, I call it a release stroke, because the nervous system wakes up to a light stroke more than a firm stroke. So this is like an eraser. So it means he can put counter pressure on her lower back when she's having a contraction, and then he kind of erases that impression that his hand would be making. Does that make sense?
Yeah. Now I know, because me and my sister have, like, this is similar to, like, because we, like, sometimes draw on each other's backs. This is similar.
Very similar.
We also have, like, massage competitions.
Oh, really? Well, that is great. Well, I think we did a good job on the massage competition today. This is great. Okay, put her there. Put her there. Thank you. Thanks, everybody. And thank you, Katie,
You're
for
welcome.
our very first Maternity Monday.